Hi friends, today I am going to talk about one important thing concerned with ophthalmology and obstetrics, that is pregnancy induced hypertension. Why people are worried when a pregnant lady has a high blood pressure? What is the role of ophthalmologist in such a situation? When a pregnant lady is having a very high blood pressure, we all know that pregnant ladies are very young. They don't have much of a vascular changes in their body like arteriosclerosis. The vessels are also very young. When suddenly there's a very high blood pressure in a pregnant female, what is the reaction of the blood vessels to the high blood pressure? These blood vessels will go in for a constriction or they get reduced in their lumen size. That is called as vasospasm. This vasospasm affects all parts in our body, leading to the damages of all the organs in our body. That is why we are worried about high blood pressure in a pregnant female. This can also happen in young persons having an accelerated hypertension. So, this vasospasm will lead to end organ failures and it may lead to death of a person also. Now, what is the role of ophthalmologist in pregnancy-induced hypertension or high blood pressure during the pregnancy period? As all of us know, the eye is a eye opener to all the organs in our body. Without much of a bigger investigations, an ophthalmologist can look into the eyes of the patient using an ophthalmoscope. He can visualize the retina, that is the portion of the eye which gives us vision by taking the light rays and transmitting it to the brain. Next is the choroid, which is full of blood vessels. This choroid is supplying food and nutrition to the outer layers of the retina. In case of accelerated hypertension or pregnancy-induced hypertension, the vessels that are supplying this choroid and the vessels in the choroid, they go in for a vasospasm so that the nutrition is affected to the retina, leading to retinal damage and loss of vision. All these things can be directly seen with an ophthalmoscope by an ophthalmologist in few minutes. For that, we do not do a very elaborate investigations. Now, let us see what is the relationship between the problem in the eye in accelerated hypertension or pregnancy-induced hypertension and a pregnant woman. Let us compare the uterus of the pregnant woman with that of the eye. The eye is having a sclera as an outer covering. You have the uterus here as the outer covering. The next, you have the choroid, which is full of blood vessels. That is going to supply nutrition to the retina. the similar structure in a pregnant woman's uterus is the placenta. Placenta. The placenta is full of blood vessels which is going to supply nutrition and blood to the growing fetus or child. Next is the retina, which is similar to the growing fetus. As I already told, in accelerated hypertension or in pregnancy-induced hypertension, there is a vasospasm affecting the choroid. Similarly, this placenta will suffer by this vasospasm. The blood flow in the placenta will be affected by vasospasm. When there is such a severe vasospasm in the placenta, what will happen? The nutrition supply and blood supply to the growing fetus will be affected. Growing child in the uterus will be affected, leading to retarded growth or intrauterine growth retardation of the fetus in the uterus, or sometimes it may lead to death of the fetus. So, I told that eye is an eye opener. So, if an ophthalmologist can identify that the choroid has suffered ischemia due to vasospasm and the retina is affected because of that, automatically he will inform the obstetrician. The similar thing is happening inside the uterus of the pregnant woman, leading to intrauterine growth retardation and sometimes intrauterine death of the fetus. So, ophthalmologist decides whether the pregnant woman has to continue the pregnancy or not. After all, we do not want a child who has undergone growth retardation inside the uterus. When such a child, after growth retardation comes out, definitely that child will not be a normal child. That will be a burden for the parents. And all women who are pregnant should check their blood pressure as advised, so that this blood pressure is kept under control, and if there is a eye problem developing in such a pregnant woman, automatically we have to decide whether to continue the pregnancy or not. Thank you.